Welcome to Book My Scans. Today, let's talk about liver function test. What is a liver function test? A liver function test helps to determine the health of your liver by measuring the levels of protein, liver enzymes, or bilirubin in your blood. When do you need a liver function test? A liver function test is not done routinely but is requested in certain situations to establish the presence of damage or inflammation in the liver, such as if you have symptoms to screen any potential liver problems or infections affecting the liver, such as hepatitis A, hepatitis B, and hepatitis C, to aid in the diagnosis of other conditions such as gallstones. When you have liver disease, to monitor the progression and severity of the disease and to determine how well a treatment is working. To monitor side effects if you are taking prescription or non-prescription medicines that can affect your liver function. Why do you need a liver function test? Liver test can help determine if your liver is working correctly. The liver performs a number of vital body functions such as removing contaminants from your blood, converting nutrients from the foods you eat, storing minerals and vitamins, regulating blood clot, producing proteins, enzymes and bile, making factors that fight infection, removing bacteria from your blood, processing substances that could harm your body, maintaining hormone balance. For liver function test. Many tests can be performed on the liver, but most of them don't measure the overall function of the liver. Commonly used tests to check liver function are alanine transaminase, alkaline phosphatase, bilirubin direct, indirect and total, Gamma-Glutamyl Transferase, protein total, serum albumin, serum globulin, aspartate aminotransferase, serum albumin by globulin ratio. Let us discuss these tests in detail. Alanine transaminase. Alanine transaminase is used by your body to metabolize protein. If the liver is damaged or not functioning properly, alanine transaminase is released into the blood. This causes alanine transaminase levels to increase. A high result on this test can be a sign of liver damage. Doctors will prescribe you this test if you have symptoms like vomiting, weakness, extreme tiredness, dark colored urine, itchy skin or jaundice. Alkaline phosphate. Alkaline phosphate is an enzyme found in bones, bile ducts and liver. And alkaline phosphate is typically ordered in combination with several other tests. High level of alkaline phosphate may indicate liver damage, blockage of the bile ducts or a bone disease. Children and adolescents may have elevated levels of alkaline phosphate because of their growing bones. Pregnancy can also raise alkaline phosphate levels. Normal range for alkaline phosphate is 45 to 115 units per liter. Low levels of alkaline phosphate can occur following a blood transfusion or heart bypass surgery. Low level of alkaline phosphate can result from a zinc deficiency or malnutrition. Aspartate aminotransferase. Aspartate aminotransferase is an enzyme found in several parts of your body, including the heart, liver, and muscles. Since aspartate aminotransferase levels aren't specific for liver damage, it's usually measured together with alanine transferase to check liver problems. When liver is damaged, aspartate transferase is released into the bloodstream. A high level of aspartate aminotransferase test might indicate a problem with the liver or muscle. The normal range for this test is 8 to 48 units per liter. Bilirubin test. Bilirubin is a waste product from breakdown of red blood cells. It's ordinarily processed by liver. It passes through the liver before being excreted through your stool. A damaged liver can't properly process bilirubin, so this leads to an abnormally high level of bilirubin in the blood. A high result on the bilirubin test indicates that the liver isn't functioning properly. The normal range for bilirubin is 0.1 to 1.2 milligrams per deciliter. There are three labels of bilirubin test: direct bilirubin test, indirect bilirubin test, and total bilirubin test. Indirect bilirubin test. When bilirubin is not attached to the glucuronic, it is called indirect bilirubin test. Total bilirubin. When all the bilirubin in your blood comes together, it is called total bilirubin. It ranges from 0.3 to 1.9 milligrams per deciliter. Direct bilirubin test is the difference between total bilirubin test and indirect bilirubin test. Serum albumin test. Albumin is the main protein made by your liver. It performs many important bodily functions such as stop fluid from leaking out of your blood vessels, nourishes your tissues, transports hormones, vitamins and other substances throughout your body. An albumin test measures how well your liver is making this particular protein. A low result on this test indicates that your liver isn't functioning properly. The normal range for albumin is 3.5 to 5.0 grams per deciliter. Gamma-Glutamyl Transferase. The Gamma-Glutamyl Transferase test measures the amount of enzymes in your blood. Since enzymes are molecules that are necessary for chemical reaction in your body, so gamma-glutamyl transferase functions in the body as a transport molecule helping to move other molecules around the body. It plays a significant role in helping the liver metabolize drugs and other toxins. This test being prescribed by doctor if he suspects your liver damage due to heavy alcohol use or any toxic substances like drugs or poison. Serum globulin test. Globulins are a group of proteins in your blood. They are made in your liver by your immune system. Globulins play an important role in liver function, blood clotting, and fighting infection. A total protein test may be included in a series of tests to check how well your liver is working. Globulin tests are blood tests. During a blood test, a healthcare professional will take a blood sample from your vein in your arm using a small needle. Low globulin levels can be a sign of liver or kidney disease. High globulin levels may also indicate certain types of cancer such as multiple myeloma, Hodgkin's disease. Why pay more when you can get the same number of tests for the lowest price with Book My Scans? Log on to Book My Scans and get up to 40% discount on market price. Please do like, share and subscribe and comment below.